Good afternoon, everyone. My name is Paul Warren, and I'm a program manager here at NDRI. It gives me great pleasure to welcome you to gender-responsive strategies for women offenders in drug court. Before I introduce the trainer for today, I'd like to take you through a few logistical details that will help you interact more efficiently during this webinar. I'd like to draw your attention to the control panel. If you click on this orange box with the white arrow, you're able to decrease the size of your control panel so you can have a more full view of your screen. And if you click it again, the control panel is restored. You'll, of course, want to use the control panel to submit questions and to raise your hand. To submit questions, just type your question into this question box. And to electronically raise your hand, you'll want to click on this particular icon. If you have any technical difficulties during the course of this webinar, please dial 1-800-263-6317. You might also want to write this number down for easy access during the course of the webinar. Without further delay, it gives me great pleasure to introduce Diana Padilla, who will be the trainer for today's webinar.
Hi everyone, my name is Diana Padilla, as Paul Warren just said. I am a program manager here at NDRI. I'd like to share with you that this webinar is brought to you through the collaboration of the Bureau of Justice Assistance Technical Assistance Project at American University and the Training Institute of the National Development and Research Institute, or as we here like to refer to as NDRI. Just to tell you a little bit about myself, being a program manager here at NDRI, I manage the cultural competency-based projects such as the Cultural Proficiency in Drug Court Practice Training Program and improving cultural competency with HIV program services, where I work very closely with Paul Warren on that initiative. I've been working in public health myself for over 15 years, both in drug treatment and HIV/AIDS services. Although the more recent professional years, I focus more on research, development, and training. Now, the purpose or overall goal of this webinar is for practitioners to review how gender issues impact female drug court participants and how they encourage or warrant gender-responsive strategies. Just to give you a little insight as to what we'll cover over the next hour, we'll discuss the issues that women offenders tend to present with in the drug court environment. We'll also discuss the differences of women offenders and men offenders. We'll also look to segue into defining gender-responsive strategies and identify interventions that you can use when working with this population. We'll also identify some of the assessment tools that are available for you and provide you recommendations towards the end of the webinar. I'll also offer a list of resources for your own further research, and I'd like to let you know that towards the end of the webinar, we will allow for a few minutes for questions and answers. Now, the reasons for this type of webinar can be seen when we go over some of these facts. The number of women in prison has increased at nearly double the rate of men since 1985. There's been a 404% increase in incarceration rates for women offenders versus what has been identified as a 209% increase for men offenders. In addition, women in state prisons in 2003 were more likely than men to be incarcerated for a drug offense, from a 29 percentage for women offenders as opposed to 19% for men offenders for drug offenses specifically. And I have to tell you, it's impossible to ignore the overrepresentation of minority women in the criminal justice system. So it's important to know that in 2005, black women were more than 3 times as likely as white women to be incarcerated in prison or jail. And Hispanic women represented a 69% more likelihood. In 2009, over 2.25 million women were arrested in the United States. It should also be noted, I guess, that that more women offenders are supervised in the community than they are in custody. These facts are to highlight and paint the current picture of the women offender population we're working with. It also helps to justify the need to identify new and effective approaches for the supervision of women offenders and their support and their treatment. So here I'd like to give you some information regarding this type of slide. This slide captures what I consider a moment of tranquility, but it's also a cue. It lets you know that we're about to launch a poll, and it also tells our organizer, Clyde Frederick, that it is time to launch that first poll. So do your best to answer with the most appropriate response that you have available to you. Everyone. Clyde, could you please launch? Okay. A few more seconds. Allow a few more folks to vote. All right. I think at this point I'm going to ask Clyde to close the poll and share the results with everyone. So what I see here is that 18% of folks in attendance just now included embezzlement as one of the crimes or issues, criminal issues that our women offenders come into drug court with. There's an 82% that did choose low-level offenses. So it's important to understand. Embezzlement is really a white-collar crime. Kidnapping and battery and murder are felony crimes. Now, most of you are familiar with eligibility criteria for drug court participants that typically drug courts include as far as participants that can come into the program, usually being of low-level nonviolent offense. So moving on. Let's talk about the pathology of criminality for women in our drug court programs. Just to address this very briefly, women are much less likely than men to be arrested and sentenced for violent crimes. And understanding the criminality for women offenders is important in terms of the behavior and underlying causes that can reflect the psychosocial issues that need to be addressed in drug court. But I'd like to tell you that in regard to violent crimes, women offenders commit, most of them are committed towards either partners, current partners, or ex-partners. And much of the data shows that a lot of these women have reported to have been physically or sexually abused by these same persons that they assaulted. But these are not typically the women that we see in drug court. Most of the criminal issues that our women offenders come into drug court with come in terms of drug dealing, holding or transporting drugs, property crimes, and prostitution. Now, looking at some of these criminal activities, it's important to understand there's a lot of money to be paid for those wanting to transport drugs or allow drugs to be packaged in the home or held there or even sold from there. So for women offenders who have been arrested during a drug bust in their homes, it can be pretty challenging for practitioners assisting female participants to access safe and stable drug-free housing. Many programs such as subsidized housing across the country or low-cost city housing decline assistance to anyone convicted of drug-related crimes, especially if it happened in their home. But what we do see is a recurring theme with women offenders, and that is that they're often, most times, the primary caretakers and providers for their children and their families. So some of these criminal activities not only provide a source of income, but also helps to support their drug use. It's also pretty common, and according to the data, that live-in partners or ex-partners are a huge risk factor for women offenders in terms of substance abuse. Women have reported to have been exposed to initial drug use by these partners or have been forced into continued use or into drug activity by these same folks. These situations, of course, exacerbate the problems for women offenders. Now, Other criminal activities can result in women offenders engaging in burglary, theft, or shoplifting, or what they refer to as boosting out on the streets, or in the sex trade, which I will speak about specifically in a moment. As we go on, I think it's time for another poll question. So I'm going to ask our organizer, Clyde, to please launch poll question number 2. And pick the best response to this question. A few more seconds to allow everyone to vote. All right, so let's close the poll and show everyone the results. So why consider gender-responsive services for women offenders? The rates of recidivism are high for our women offenders, and grants an awesome reason for considering gender-responsive services. Also, according to the NIDA studies, we already know that individualizing treatment or treatment plans or the treatment process correlates with positive outcomes for our offenders. Women also have special needs that, left untreated, can result in continued criminal and drug activity. So any one of those responses any one of those responses are appropriate, but the best response is all of the above. Great reasons to consider gender-responsive strategies or services, particularly if traditional modalities are not providing the effective outcomes with women offenders as we'd like them to be. And I just want to I want to throw something out there. Gender-responsive services can provide another benefit. And the evaluations for gender-responsive interventions have been so positive that in terms of future funding, and can provide better positioning for a drug court that is integrating these services and showing these positive outcomes. Considering the competitiveness of the economic atmosphere lately for funding, this is an excellent way of putting yourself in a better position. Thank you, Clyde. Now let's look at some gender differences, and this is a type of quick glimpse. It's important to understand that the women's pathways to crime differ from men's and include influences such as trauma, mental health, and substance abuse difficulties and poverty. To go briefly over this chart that I have here, according to the National Resource on Justice Involved Women, women offenders present with, have reported 47% of women offenders have reported physical abuse, up to 39% have reported sexual abuse, as opposed to men offenders who have reported 13% of physical abuse and 6% of sexual abuse. So it's much higher with women offenders. Now, women offenders, 73% have reported a mental health problem, with just under 24% being diagnosed. And while it's not as high, it's still a prevalent issue with men. 55% report mental health problems. Just under 16% have a diagnosis. Women offenders, 60% of them have reported a history of substance abuse, as opposed to the men offenders who report a 53% of a history of substance abuse. And one of the more distinctive differences between women and men offenders is that 2/3 of women offenders are parents or caretakers of children under 18. The men offenders are less likely to serve as a primary caretaker. 50%, and this is probably not an unusual stat for most folks who are working in drug court, 50%, at least 50% of women offenders are unemployed before arrest. Men represent about 30% who are unemployed before the arrest. And that might give you something to think about in terms of how difficult it is for women offenders to provide not just for their children or their families, but also in terms of women offenders who do qualify and enter the drug court programs when their participants are required to make payments. So looking even deeper into the issues that women offenders present, Women offenders often have extensive histories of sexual victimization and other maltreatment. This is particularly salient for pregnant women offenders. Studies show that there's strong interconnections between victimization, mental illness, and self-medicating. And I know that's not unusual, but a lot of times when these problems and these issues are exacerbated, one impacting on the other, substance abuse for a lot of women seems to be the only coping mechanism that they have. Medical and mental health needs tend to be greater for this population. And women do have a number of unique risk factors, as we will go over in a couple of minutes. They're protective factors and intervention needs that differ from male counterparts, which really speak to specific strategies to address these needs. And further, incarcerated women are more at risk for self-harm than for violence toward others, which does speak to the level of substance abuse and alcohol abuse. Now, according to the Bureau of Justice Statistics, also compared to men in custody, women are disproportionately victimized sexually by other inmates and staff while incarcerated, which just further compounds the existing issues of trauma and mental health. Now let's take a moment to focus on prostitution. Though prostitution is technically one of the lowest rated crimes or low-level offense, it does have major implications in terms of higher rates of physical and mental health, including the extensive histories of trauma and psychological consequences. Studies show that women offenders with a history of engaging in the sex trade are likely to have been raped or sexually abused in childhood as well as during adulthood. Now, these factors can either lead into engaging in this illegal criminal activity, of engaging in sex trade or prostitution, or a lot of times can be the consequence of engaging in a sex trade, a type of occupational hazard, if you will. For some women offenders, engaging in prostitution can be a response to their current life stressors. Many are either living or hanging out in areas where there are high rates of drug activity or criminal activity, and often it's very common to know that a woman can report that she is currently in a violent relationship, suffering victimization at the hands of her partner. Another issue to really consider with women who engage in the sex trade, especially in the long term, it speaks to their physical health. There's a prevalence of chronic health issues. Asthma, heart problems, hypertension, cancer, HIV, and other STIs are pretty prevalent with this population, where frequently many of these women receive little or no medical or health care between periods of incarceration. Regarding mental health, they were more likely to report they received a mental health diagnosis like PTSD. But there are also reported high rates of depression and bipolar disorders and schizophrenia. Now, I'd like to call your attention to a couple of initiatives that are currently addressing the criminal behavior of prostitution within some areas. There are what we're calling operating prostitution courts. The Circuit Court of Cook County Wings program in Chicago was initiated in January of 2011 and is currently presided by Judge Rosemary Grant Higgins. Another initiative, Project Dawn Court in Philadelphia, is presided by Judge Lydia Kirkland. Now, these courts are great resources to follow up on. They look to connect nonviolent repeat offenders with therapeutic and reentry services such as prevention, crisis care, individual therapy, legal advocacy, and health care. And by providing these types of services, the courts can further help to make the community safer by reducing recidivism for women offenders charged with these crimes of the sex trade, of prostitution, and can also help to lessen the financial burden of the taxpayer paying to keep minor offenders in jail by addressing their specific issues. Now, here goes my favorite moment of tranquility. It is time for another poll. Clyde, could you please launch the next poll? A few more seconds. Just let just a couple more people to respond. One more. All right, let's close the poll and share the results. Now, a large number of you are providing gender-specific services for women offenders, and there's a substantial number of you that are not. So this will speak to what we're going to describe and what we're going to present to you as far as available interventions, what the approach, what the concept is about, and the recommendations that we will make for you towards as we move on in the webinar. Thank you, everyone. Let's close that off. Gender responsiveness just simply means understanding and taking into account the differences in the characteristics and life experiences that women and men bring to the criminal justice system. It's a concept that refers to programs that considers and tailors a strategy or interventions to the needs of a specific population in all of its all aspects of design, of delivery, staffing, program development, even including location and the materials that are used. For our purposes, we're referring to women offenders. So gender responsive services in terms of the population we're speaking about should have strategies and approaches, interventions tailored to the complex psychosocial issues that women present with in your drug court environment. So also it's a multidimensional model that addresses women's complex issues. If you consider, we are no longer supporting the age-old argument about which issue to treat first, the substance abuse or the mental health. What happens is it's possible that the drug court participant can have certain issues addressed, but since every area of a person's life impacts the others, it's appropriate to be able to take a comprehensive multidimensional approach to be able to address these issues simultaneously. So some of the guiding principles include the following. First and foremost, gender. Acknowledge that gender not only makes a difference, but accommodate for those differences between men and women offenders. Tailor the approaches specifically to the issues of the women offenders. In terms of environment, another principle for gender responsive services is to create an environment that is safe and that includes respect and dignity, something that for a lot of women offenders is something they're not used to experiencing. This can create a conducive atmosphere, conducive to their recovery and their engagement and retention in the program. Relationships. It's suggested that you develop policies and practices that are relational and promote healthy connections to children, family, significant others, even the community. And we're going to speak more specifically about this. Services and supervision. It should include recognition of how substance abuse, trauma, mental health are actual critical issues for a woman offender and her recovery process. Integrating programs that can address these issues through like assessment and treatment and coordination of services is very important. Economic and social status for women offenders. It's important to understand that there's a need to improve their socioeconomic outcomes. So provide opportunities through education and training so they can support themselves. And what I'm thinking here is like training that not solely provides employable skills so they can be self-supporting, but even opportunities that can lead to an actual profession. Regarding community, because of the issues and the potential baggage that women offenders can re-enter the community with, it's important that to be able to support with wraparound or multidisciplinary services and approaches to be able to support the outcomes or positive outcomes for women offenders. Now, women's integrated treatment should include the concept of the experience and the impact of living as a woman in a male-based society. So including gender as part of the clinical perspective is key to their successful behavior change. So women's integrated treatment should have the venues to address substance abuse and trauma in women offenders and understand and recognize the interconnection. incorporate or integrate the principles of gender responsive services, as we just briefly went over. It is also based on theoretical perspectives, which I will briefly go over after the slide. And we spoke about the comprehensive, multidimensional, therapeutic aspect of interventions for women's integrated treatment. And this is a concept of an intervention of how it specifically speaks to the issues that women offenders present with. So here I am again. I am going to ask you yet another question. Clyde, could we launch the next poll, please? So what are theories? And please choose the best response. The best of your ability. Give a few more seconds. Allow for some more participants to respond. A couple more seconds. All right, let's close the poll and let's share the results. These are great, because 25% said that these are ideas. In a sense, they are, but that's not necessarily the best response. There is a certain amount of you folks that did choose static and concrete. They're not. These are, there is no templated idea that forms a theory. The best response is actually based on a hypothesis. It's actually a tentative explanation, and it's backed with some evidence. And for women offenders, it includes their life experiences. Thank you, Clyde. Let's close that off right now. So in terms of gender responsive services, the concept is based on a few theoretical perspectives. First, let's look at relational cultural theory. Females develop a sense of self and self-worth when their actions arise out of and lead back into connections with others. Relational cultural theory as a focus of female development suggests that a primary motivation for women throughout life is to establish or the establishment of a strong sense of connection with others. So if you consider some of you who have worked with female offenders who have had prior experience in the criminal justice system, that have done some time in prison, it's not unusual for you to note that they refer to a type of family that they may have developed in the prison system. There's a need for a sense of community, a sense of belonging, and this is part of female development, which provides us with a unique opportunity. That connection, that alliance for women offenders, there's something that can be built upon to establish or reestablish healthy relationships with children and family members that we can use as support system to support the recovery process. It's also another opportunity for practitioners when building a rapport with the women offender that they're working with. It creates a comfortable, conducive atmosphere for information sharing between the drug court participant and yourself. And this can be extremely important, particularly in terms of women offenders who have other issues of trauma, mental health. Another theoretical perspective that the gender responsive services concept is based on, addiction theory, which speaks to providing substance abuse treatment that is holistic, that is comprehensive, that's multidimensional. And we've already spoken on that. Also using women's support resources. Understanding that not just that women's support resources can be extremely beneficial when you consider what we just discussed regarding the connection or that need to have an alliance with others. There's been some data to support that in some drug courts and for women offenders, female support groups can be a huge benefit. Women offenders in terms of if you consider the camaraderie, the support, the feeling supported. I had a client once who told me that one of the best things she liked about the treatment facility was that she really liked her all-female support group. She felt like other women had been there and done that, and I think that's a familiar term for a lot of us. She felt that she was understood, that another woman who had been in the same type of predicament, even if it wasn't exactly the same, can best understand her than anyone else. It wasn't that she was disconnecting or disassociating from the counselor she was working with, but there was something important about the atmosphere and feeling like she wasn't alone. She said it was something, she explained that it made her feel a little stronger. So that speaks to a sense of empowerment that some of our women offenders do get when they have the type of resource available to them. Another theoretical perspective that the gender responsive strategy concept is based on is the trauma theory. Trauma influences criminality in responses to the justice system interventions. It's important to understand or to recognize that trauma is a response to physical, emotional, and psychological harm from witnessing or direct violence and abuse. So by addressing these traumatic issues for women offenders, it can help support behavior change. At times, trauma can be at the heart of why participants may not comply with some of the program requirements. And it really encourages us to explore when we think we see a client not being compliant. Perhaps there is an issue of trauma that has yet to be identified with this woman offender. So the trauma theory also speaks to the need to provide healthy coping skills or how to manage recurring symptoms of past trauma. There are times when this can, PTSD, anxiety disorders, or there can be a relearning of how to respond to triggers to cope with these symptoms as opposed to how to react. So part of the trauma theory encourages a trauma-informed care. And this is an approach that engages people with histories of trauma and recognizes the symptoms and how it can impact behavior. When a human service program takes the step to become trauma-informed, it speaks to how the organization, the management, or the delivery of services is assessed and potentially modified to include a basic understanding of how trauma does affect the life of an individual needing services. There are some drug court programs in recent years that have integrated trauma-informed care into their infrastructure, into their drug courts. And part of that is to avoid re-triggering or re-traumatizing our drug court participants. There are courts such as the Santa Barbara Circuit Court, presided by Judge Rogelio Flores, who have recently presented the issues of implementation and the evaluation outcomes, which were very positive for when they integrated trauma-informed care, and they saw higher rates of graduation with the women offenders in the drug court program. Now let's look at gender responsiveness and thinking of how important it is to integrate gender and culture. We really need to recognize that women offenders are not a homogeneous group. As practitioners, we need to understand that many women identify as they can identify as heterosexual women or lesbian women or trans women. And integrating gender identity is important in terms of accessing referrals, a tailored session of information sharing with the drug court participant. And another issue that is closely related but not exactly is studies show that addressing sexuality is an important part of the recovery process and the healing process for women offenders. Many women don't even understand the basic functions of the female anatomy. It can be especially important when you consider the histories of past sexual abuse. So assessing and understanding just how specific that is to certain women offenders and integrating that into the gender responsive atmosphere that you are creating or will create is really important and key to their behavior change, to their motivation to change behavior. Gender and culture also impact on past and current behavior. Culture has so many different definitions. It almost changes person by person. But it does include how a person looks at the world around them. It also includes on how they live in it, or how the world has impacted on them. So a woman's past and current experiences influences her perception and consequently her behavior. So it is wise to include culturally competent approaches when working with women offenders. And remember, we were one of the first facts that kind of laid out the work that the discussion that we're having now, is the overrepresentation of minority women in the drug court environment, in the criminal justice system. And these can't be ignored. You really have an opportunity here to use that to your drug court participants' advantage, and you as a practitioner. By integrating the client's culture, you can help individualize that service and case plan further. You have an opportunity to assess clients or drug court participants and learn about the values that they adhere to, and look to build on the strengths within those values. And that can help not only support but individualize that service plan. It essentially helps them to be motivated to commit to the program, to succeed in the program. Okay, please excuse my arrow. Let's talk about some associated factors, and I think maybe most of you folks are familiar with this. There's a substance abuse treatment publication addressing the specific needs of women, Tip 51, and this grid is based on the information there. Risk factors associated with substance abuse include partners or family who abuse alcohol and drugs. This kind of speaks to the mantra of the recovery process for a lot of the 12-step fellowships or programs that are out there that speak to people, places, and things. When our women offenders, our drug court participants are leaving the programs, are leaving the court after status hearing, where are they going back to? Who do we know they're going back to? Another issue that's related to substance abuse and the drug criminality, over responsibility with family. Because women offenders tend to be the caretaker and main provider, or at least the caretaker for the children and family, there's issues. Imagine the huge stress level that correlates with substance abuse when you consider that she has to feed those children, she has to provide a clean home, she has to take them to school, she has to take them to the doctor, she has to go out and work, and she has to deal with her own level of stress and deal with income issues, and so on and so forth. So it's easy to see how the over responsibility with family can be a huge risk factor in helping our women offenders in drug court to learn how to have a healthier way of managing their lives and the issues within it. It's really important. Another associated risk factor for our women offenders are the extensive history of violence, sexual abuse, and other traumas, as we had discussed already. I wanted to refer to the acculturation, again referring to the overrepresentation of minority women in the criminal justice system. There are huge issues when a person that identifies with a particular cultural group is holding on to their own cultural identity, the traditional norms that they may have been raised with, what they've always known to be part of who they are, but trying to also adhere to the values of the dominant culture. Huge stressors, and there's data that correlates both acculturation and the stress level with substance abuse. So now let's look at something more positive, the resilient or protective factors. Now, understanding and really assessing for partner or family support is really a key factor when our female drug court participants are leaving the immediate area, leaving the treatment facility, leaving the drug court program, and going back into the areas of where they live, who they live with. It's important to understand that you can build upon the partners who are supporting, or the family members who do not use drugs, who don't use alcohol, to support their recovery process. As I stated before, when speaking from a cultural perspective, religious and spiritual belief systems are opportunities practitioners can use and encourage participants or women offenders with in terms of other support systems. Also, community alliance, that interconnections that need to belong, to be a part of, which is has been identified as part of the female development. That's important to do. A lot of women have not ever really participated actively within the community, and there are activities that the drug court programs can initiate with women offenders that can help them feel engaged, feel like they belong, into something positive. Integrate drug court participant culture, as we spoke about. Sexuality, the need for basic health care, the need for understanding how the female anatomy works, understanding how to take care of it. You know, these are basic functions, fundamental information that not all women offenders have. And if we really give you time, you're likely, I can probably give you time and you can come up with other suggestions. What other protective factors, in your experience, have you seen our women offenders have that you've been able to build upon? This is a good time. If you'd like to, you know, you can actually type in your question area. Well, while I give folks a chance to respond, I'm going to move on to the next slide. And let's look at the domains for assessing risk factors. It's important to assess for women offenders in terms of gender responsive strategies, domains to really have information to tailor your approach to the female drug court participants. It's important to understand how long have they been actively using drugs, what types of drugs, what triggers it, when do they use, what's the relationship status, are they healthy, are they unhealthy? Regarding self-efficacy, can they handle transportation to the referrals of ancillary services that you may provide? How well do they manage their, they may or may not manage their family or the issues with children? Understand how well do you think they may be able to manage around the program required activities that they need to follow through with. With mental health, is there a documented diagnosis of depression, anxiety, PTSD? Regarding parental issues, how many children do they have? Who's taking care of the children when they're in the drug court, when they're expected to go to drug court or follow through another other required activities? When they have to go to status hearings, a lot of drug courts don't allow for children to be brought with when they have to present before the court. What type of support systems do they have in place? And we just spoke about using faith-based belief systems. Sometimes when we access do they ever have any past experience with being in a 12-step program? Financial status, can they provide for themselves? What kind of income do they have? What about the safety? Not just in their community, but are they in a violent relationship at the moment? So in the strengths and protective factors, this is essentially what we're speaking to. I want to call your attention to just some of the tools that are available, assessment instruments. For instance, like the Women's Risk Needs Assessment, the WRNA. This is a tool that can be used concurrently with either your ASI, your ASAM. A lot of courts have hybrid forms of screening and assessment tools. This is an assessment tool that you can also use to assess the risk and needs of these women offenders. COMPASS, which actually stands for Correctional Offender Management Profiling for Alternative Sanctions. It's so much easier to say COMPASS for women. This particular type of assessment is designed for adult women, youth, and reentry offenders. It helps to determine placement or supervision and case management issues for folks or women who are either in community service or in correctional institutions. There's also service planning instrument for women, the SPIN-W, and I think that's familiar to a lot of you folks. There's also organizational assessments. For instance, the NIC Gender Informed Practice Assessment or Gender Responsive Program Assessment, looking to identify what strategies, what interventions, what approaches are in place to work with the specific needs of the woman offender, or identify where a program can include or integrate some of these concepts. Now, these are just a few of the assessment tools of many that are available. I cited at the bottom of the slide the International Community Corrections Association, and there's a link there where if you go to on your and you surf the web and you put this in your browser, it will show you a whole host of different assessment instruments that you can use. Just to give you an idea of some of the gender responsive programs and interventions, the Women Offender Case Management Model. WLCMM, has been used for a few years now and has been shown to have promising results. They provide wraparound services and they work specifically with women offenders around the specific issues. There is another model, dialectical behavior therapy, and this is specific to women who have identified PTSD, where there is a diagnosis in place and it has been shown to be very effective. The next three: seeking safety, helping women recover. Beyond trauma, a healing journey for women. Barbara Bloom, Stephanie Cummington are pioneers in gender responsive services, and these are cognitive behavioral therapy-based interventions that they help develop. And I strongly encourage you to look up more information on this. There's also a Forever Free program. This is specific to the women offenders in California, also showing promising results. So here I am. This is the last time I'm going to ask Clyde to send out a poll question. Clyde? And what I'm asking you is, considering the brief references that we've gone over so far and the information that you've been using and the work that you've been doing, can you rate your own competency level when working with women offenders? And the great thing is there are no names attached, and I don't have to say that, but it shows you where you are at and what you can do to improve. Just another second. All right, let's close the polls and let's share the polls. This is wonderful. You have experience working with women offenders, and the 60% that said you're in between there, 3 to 6. That's great. 40% of you feel you're very not just competent but proficient with your clinical practice and in terms of working with women offenders and your effectiveness. What is important to note here is that no matter where you categorize yourself, no matter how you rate yourself, there's always more information you can learn. It's great to always add more skills to your toolbox. And that's really important in the work you do, because the demographic information for the women offenders that we work with are constantly changing. Seemingly new issues seem to come up and new challenges. So it's important to stay open to new information. Thank you all for responding. So I'd like to share with you some recommendations. Acknowledge differences. Recommendations for working in a gender-responsive conceptual framework. Acknowledge differences for women and men offenders and accommodate for those differences, and tailor your interventions or add strategies that specifically address the psychosocial issues that women present with in drug court. Assess for women's risk levels and needs and strengths, and that's going to, using these some of the assessment tools that we just discussed and referred to, will give you a very specific picture of what the women offender is presenting with and what direction that the treatment plan should work in. The nice thing is it also assesses for strengths, and this is going to help you. Innate strengths that women have that they don't often see, you can identify and can use to support their recovery process. Acknowledge that different drug criminal pathology exists for women offenders in the criminal justice system. Also, let's recognize that there are significant histories of victimization and traumatization. And we'll look to work on women's strengths and values, these resilient factors that can be built upon for working with this population. Identify and build on women's strengths and values. This would also include their need and importance for relationships and the connection to others in the community. These provide you wonderful opportunities to be able to engage women offenders and help them stay motivated and committed to behavior change. Women offenders are most often primary caregivers to children and others family members, as we all well know. So providing, I was thinking perhaps while a lot of ancillary services or drug court programs do not necessarily allow for women to have their children with them while they're in treatment. And child care can be a huge issue for some. I know there is phases or stages that drug court participants go through, and there are rewards and sanctions for achieving the goals and moving on to the next phase. Some drug courts have what they've done is, instead of just moving on to the next phase and just giving a voucher to go to the movies, sometimes the women are allowed a certain amount of time, not necessarily having to be in a drug treatment facility, but they're allowed a certain amount of time to spend with their children doing a particular activity as part of their drug court required program activity. We can be creative like that with this, and it really doesn't cost a lot of money. But these are wonderful motivations for women offenders, and helps them to stay motivated to change behavior, to keep that drug-free and law-abiding behavior that they are engaging in while they're in the program, so they can hold on to that when they re-enter the community. Very important here. Engaging and training staff. Now, for rural courts are in areas across the country where accessing ancillary services may be a major transportation issue, or lack of funding, or perhaps static court structures that don't allow for adding gender-responsive services or components of that. I would suggest that the individual practitioner can make a difference. You can elevate your own skill set by accessing some of these resources that we will be providing you, and some of the publications. And even if you don't have an actual component of gender responsive or trauma-informed care, the individual practitioner can help to make a difference with women offenders. Elevate your own skill set in terms of accessing this information. Webinars are a great way to attain information. I know a lot of you practitioners are challenged with by not being able to attend conferences, to attend formal trainings. American University is a wonderful resource. Their technical assistant project is providing you with these webinars, and I'm going to tell you about a couple more that some more that we're going to present. And this is a great way to also access the publications and the information you need. I strongly suggest that for gender responsive services and to visit the stephaniecovington.com website. There are a lot of free publications that you can access and can really give you not so much as a history as opposed to a breakdown of what these interventions look like, what are the steps to implementation, how you can elevate your skill set. So that website is really www.stephaniecovington.com. Here are the references, and I'd like to take a few minutes before we conclude for some questions and answers. I know we've gone over briefly just touching on some aspects of gender responsive strategies, but I think we've made the case and related the coexisting issues for women offenders and why it warrants gender responsive strategies. Are there any questions at the moment? If so, please use your text box to type it in. Let me address this one question. One of the challenges that has been voiced for many practitioners working with, especially with women offenders and their early stages of recovery, is how to help them avoid romantic relationships in early recovery. It's recommended that people in general who are still within their first year of recovery to avoid engaging in a romantic relationship in the beginning stages of when they're learning how to live sober. This speaks to the information you're going to provide. It speaks to the required meetings with AA and NA that voice the same suggestion. But one of the challenges is that when people first go into recovery and they stop using for any length of time, they're not numbing their feelings, both emotionally and physically. And even physical attractions to other people are misinterpreted as emotional attachments. And this is part of also their need to connect to another person. So providing information that can earn those coping skills to help them understand the need to focus on themselves is really key and very important to their recovery process. Are there any other questions right now? Okay, well, here's what I would like to share with you. You have references here. These are resources that you can look up. You have some of the information presented in this webinar is based on these resources. Another issue is that you can follow up on your own. These informational resources can provide you even further links, and there are free webinars and free conferences that you can participate in without physically having to go to. What is your advice for Latinas in depression? You really, that's one of the questions that one of the participants is asking. And let me just suggest something to you. You really need to be, have a clinician, a social worker to do an appropriate screening and assessment. Use appropriate tools. What can be confusing, particularly with Latinas in our drug court programs, is the fact that there are certain cultural syndromes that are very prevalent to this cultural group. Latinos tend to express a lot of their cognitive experiences are expressed somatically through physical symptoms. It doesn't necessarily mean that there's a mental health issue, but a screening tool and being informed about Latinas will help greatly in understanding that and using a cultural approach to be able to address that. There are some women in this group and in other groups who do seem to reflect symptoms of mental health issues, and when our screening tools do not always pick it up. So it's important to be informed to be able to tailor your approach accordingly. Any other questions? What kind of gender-specific services for women are most effective in evidence-based practices and services? We've mentioned a few of them now. There are the Women's Integrated Treatment as an intervention that has been showing positive results. Some of the others, like Seeking Safety and Beyond Trauma. Trauma-informed care, it's more like a promising practice, but it's quickly going towards evidence-based, only because it's still in its early stages of evaluation. Please look out for this kind of information as it is becoming quickly. It's being evaluated, so it can be considered an evidence-based practice. What I do suggest is SAMHSA happens to have their website of evidence-based practices and interventions. They're listed on the NREEP website, and it has a host of very specific items that you can choose to provide you with the type of approach or intervention that you're looking for. Someone else asked, can programs for men be adapted for women? What I suggest here is any intervention from a gender-responsive perspective can be adapted to the gender that you're working with. That's what is so great about this particular perspective. As long as it's tailored to the psychosocial issues and needs of that person, of that gender, whether someone is identifying as a man, a heterosexual man, or a woman is identifying as a lesbian woman, or a person is identifying as a gay man. These gender-responsive strategies allow you the opportunity to tailor interventions. Now, we're almost out of time, and I'd like to just make one more suggestion. The first 2 weeks in June, we will have the last of our gender-based webinars, although we have more webinars on veterans and the neuroscience of addiction. The next upcoming gender webinars are gender-responsive services for men. Part 1 is men's integrated treatment. That will be on June 7th, and you will get a notification about it between 3 and 4 o'clock. Also, gender-responsive services for men, effectively engaging men in treatment. That's June 14th. the same time frame, 3 to 4. Your presenter will be Dan Griffin from Griffin Enterprises. And before I sign off, I just want to say thank you so much for attending and watching this webinar. I'd like to suggest that you please don't forget that there's a survey at the end of the webinar. Please fill it out and submit it. From my organizer, Clyde Frederick, from my colleague, Paul Warren, and myself, Diana Padilla, thanks so much for attending our webinar today.